think starting with the definition of RUSP, we've been using that term. It's the Recommended Uniform Screening Panel. So it's got 3 words in there that aren't completely specific. It's recommended, so it's not required. It's uniform, but again, it's recommended uniform, so it's not throughout the country. It's not a national policy. This is recommendations from the federal government. And then it's a screen, so it's not diagnostic. So you have 3 things that leave a lot of vague words that can confuse families and providers as well. Part of our training when we learn to be geneticists is going from, oh, baby has an abnormal newborn screen, to now I have to do something about it, because the screen is not a diagnosis, even with molecular sequencing, which I think surprises a lot of people. Even the legislators and the families that are wanting to use this technology and this avenue to save these babies and really make a marked difference in their lives, getting a positive newborn screen is not the same as getting a diagnosis. And that can be really startling to even other physicians who don't deal with these phone calls and breaking this ice. Another difference is because this is not a national policy, each state by state has both a different panel set of disorders they look at. So even if you have a cousin in Wyoming or a cousin in California, if you live in Pennsylvania, your baby is getting screened for a different set of disorders, and you don't know that necessarily until you go to your state's website for newborn screening. So that's another difference as to why patients and families may not be aware of what their child is being screened for. It's just a heel stick Band-Aid that your child comes back from, getting washed, and you have no idea when you're recovering from delivery yourself what happened. You don't think it's bad, but you don't know that it's occurred necessarily because there's not a consent process, because it's a state mandate, state by state. Some families can opt out depending on the state, but typically it's recommended for public health and safety.